Hello all, this is Mrs.Lalithamani.D, Professor from SNS College of Nursing. In this lecture series, we were learning about the cataract. It is a disease which is happening with the lens. So, in the last two lecture series, we have learned about the overview of cataract, the risk factors, the types, and who are the people prone for, and what are the symptoms of it. Everything we have learned. So in this lecture series we will be learning about the diagnostic method, prevention, treatment, and we will be concluding the topic. So we will be starting to know about cataract by merely having an inspection of the patient. When merely looking at the patient with bare eyes or itself, we can find out the opacity of the lens, because the opacity will be like a cloudy structure. So when there is a cloudy nature, we may suspect that it is because of the translucent or the transparency of the lens is being lost, and it is happening with the cloudy look. So what happens, automatically the patient will be having a blurred vision and a yellowing vision. Everything will be seen as we have discussed. So the diagnostic methods include comprehensive eye examination by an ophthalmologist, visual acuity test, that is reading eye chart, Snellen's chart, or the slit lamp examination to inspect the lens clarity, retinal examination to assess the lens and retinal health. So we will be having four kind of diagnostic methods: comprehensive eye exam, visual acuity, slit lamp examination, and to retinal examination. So coming on to the treatment, we have only two options. Since it is an eye structure, we have to go for either surgical or non-surgical management. If it is a non-surgical management, stronger glasses or contact lenses are needed. That too it is in the case of person with early stages. So if that is not happening, and they can also go in for anti-glare glasses and better lighting solutions. So the surgical management includes cataract surgery, removal of clouded lens and replacing it with another artificial lens. So this condition is highly successful, and the outpatient procedure it is being done. 95% success rate is seen in this condition. So when we say something like the patient is going in for conditions like daycare procedure or 95% success rate is available, it is nowadays it is being taken as a condition where the patient can walk in, get admitted, do all the procedures, get admitted, and come for the surgery. And the surgery is also done in a fraction of lesser time as when compared to a long procedure. Nowadays the procedure is done even through robotic surgeries. So however it is, the surgical and non-surgical management is very, very important. So how to prevent this? How this cataract can be prevented? So wear the ultraviolet protective sunglasses and hats. Why? Because we know that UV rays will directly harm the retina. Quit smoking and limit alcohol consumption, because these drugs may have an impact on the retina and the retinal blood vessels, including the lens. Maintain a healthy diet which is rich in antioxidants that includes vitamin C and vitamin A. So maintaining a healthy diet which is having more antioxidants, we have seen that if there is any lesser amount or low content of vitamin E, definitely there will be those people will be with a high risk factor. Regular eye checkup, and especially after the age of 60, will help in patient to identify the cataract in an early stage. Manage chronic conditions like diabetes, and also go for treatment as needed. So when we conclude this session, we need to think about the cataracts are common, treatable vision impairment. So it can be treated either surgically or non-surgical management. Early diagnosis and lifestyle changes can delay the progression. So, early diagnosis and lifestyle changes can delay the progression of the disease, and it also will help in management in a non surgical way, also. So, and surgery is highly effective for restoring vision. In all these cases, if it is being failed, we can go in for surgical measures. So far, thank you for listening the entire lecture series about cataract. We have discussed about starting from what is the definition, what are the risk factors, what are the changes in the lens, and including management we have seen. Thank you.